Frequently asked questions. There are questions that patients frequently ask, and so we're going to try and answer just some of those for you. Passwords. Passwords are case sensitive. So that means it's important that when you put in any password you remember whether to use small case or uppercase. And the computer always recognises a difference between the letter O, or the figure 0. So again, that's something you need to look at and make sure. And remember, if you leave your passwords lying around, it's just like a bank card. Anybody could use it. Particularly if you've left your password and your codes and everything together, somebody is bound to look at it. So the security depends on you, the patient. Identity theft. Well, on the first screen there is no information about the address or the patient. There's no NHS number. Those can only be seen if and when they've gone through 2 passwords to get to your letters, and that's on the letters. But again, that's something that within the NHS is being worked on, so that addresses are being left off and it's just going to contain the national insurance number, the national health number. Another one is, what if I mess it up? Well, no matter what you click, you can't alter it. There's nothing you can alter on there. So don't worry, just have a click at everything. But you can cancel appointments, so that's one thing that you can alter. And you can order repeat prescriptions. And when ordering repeat prescriptions, it doesn't necessarily trust you the first time, because it asks you, are you sure this is what you want? And it shows you the screen of what you've ordered. So even ordering repeat prescriptions isn't something that's to worry about. What if you've seen a doctor and there's no computer in the room? So if you've gone to see a specialist and you thought, right, I've got all this information on screen, I can use it, but there's no computer. Then the thing to do is, if you know you're going to see a consultant, always make sure that you've printed off some of the information, the relevant information that you want to show to that doctor. Seeing a consultant and seeing a doctor carries a responsibility to you as a patient as well, because as a patient it's up to you to make sure that you give the doctor the correct information. What if the doctor I'm seeing to objects to me showing him the information? Then apologise. You've gone there not to aggravate the doctor, you've gone there to see the doctor because you want the best possible attention. So if the doctor doesn't want to see it, or if he finds it's objectionable, just apologise and just carry on. Remember, the care you're getting is still there. Ethical questions. There are some, and there are disadvantages as to everything. And Dr. Hannon will always tell me about the disadvantages.